Hey, have you ever had this pain that just comes right into one side of your eye and it doesn't go away? Or maybe it comes on one side of your face, or sometimes it just wraps around the top. Well, that's what we're going to talk about today. Today's subject topic is headaches. And stay tuned, we're going to discuss all the 7 types and how you can recognize them and different ways to treat them. Okay, hi, I'm Dr. Jon Gray, and today we're going to discuss headache, where it comes from, and how we can get rid of them. Okay, so when we first talking about headaches, there's 7 types of headaches that are typically recognized. And we're going to talk about some variations in here today too, because I know you guys watch videos out there on the internet and see some different feedback. So I'll tell you where some of those ideas come from. Um, the first one's tension headache. And this is listed in order that most people get them in. Um, tension is normally number one and is commonly believed to be 90% of all headaches. Now, tension has a couple of factors with it. Tension can be structural tension, like I'm tight in the neck or I'm out of place or I have bad posture. That's where a lot of that comes from. But it can also be how you think about things and how you stress, which will translate into how you hold your posture. The next one is sinus. So tension headaches, I'll tell you too, as we come, they typically have that pain pattern right across here, like if you're wearing those old headbands from the 80s for tennis players. Um, and then sinus headaches, this is like if you're putting on paint, to decorate yourself up for war, you would have it come out here, and it kind of like if you imagine an X coming off the nose, down into here, and then up into here over the eyes. Then we have exertion. That's if we push things too heavy. This is people who are going to be lifting things, try to move your furniture, and maybe it really goes into more of it goes back into tension because you strain and you have some structural stuff that go into there. Or people that lift weights, especially if they load the weights on, especially in squats or different movements where they load the neck or upper back inappropriately, they can get that exertion headache. But typically, this is not referring, that falls into the tension more. This stuff here is referring more to some of the vascular sensations you're going to have for when you overexert or when your blood pressure goes up. Then we have migraines. Everybody's heard about those. Migraines will typically be on one side of the face, and it's not where if you come down here to cluster, you'll have a cluster headache that'll be like right in one eye. It'll sit in one eye, where the migraines will tend to be the whole side. It'll be the jaw, the eye, the temple, and the neck. Then you have hormonal, you have hypertension, and hypertension will feel a lot like exertion for obvious reasons because you're dealing with a vascular component. And then I wrote in here there's 7 types of headaches, but they're actually finding out that they're dealing a lot with 8 types now on a regular basis, and that is medication overuse. And medication overuse, you're going to find those headaches. It's like if you're on a lot of anti-inflammatories or pain relievers, especially, and then you get a rebound effect, like if you've been off them as you wake up, and that's why they're more common in the morning. These headaches are more common in the morning. So I just want to go back and revisit. So those are all the types. Remember, we have this structure here that we always work off of in our office. We have a 3-step thing we look at: nutrition, structure, and mental. And we're going to plug these into each one of those areas and see where they fall out at. Now, our goal is always when we're dealing with these is that we have a solution for you that's sustainable. It has to be something that you can do for a long period of time. I'll give you an example. I had a patient a couple years ago that had come into me with back pain. Now, when we got looking at him, we realized that the back pain wasn't typical back pain that we normally see with something. So we took some x-rays and found out that when we looked at 3 to 4 levels that they had, they all looked like their vertebrae that are normally solid little squares. They look like asteroid fields, just like little dots spread out through there. And what had happened is she had demineralized and the vertebrae had broken down because she had been on heavy duty steroids for a skin condition. Now, to us, that's not a sustainable solution because now this person was having so much problems from taking the first medication, the solution to their problem, that they can no longer do it. That's no longer an option for them. And then plus they have another major problem they have to deal with. They had significant instability in the back from this approach that had been taken. So we never want to do anything that's going to give you more trouble in the future, and we would end up stopping doing anyway. That's not a sustainable. That's what I mean when I say we like to do something that's sustainable. It has to be something that you can do indefinitely or corrects the problem right away. The next part is we always want to treat the problem, not mask it. So that's always preferable. And the third part is value. In other words, if I was to tell you that I had a great solution for removing pimples, but it was going to cost you $50,000, that's not value to you compared to what the benefit you're getting. So we always try to keep benefit to solution equal and a good quality of value compared to what you can get out there otherwise. So this is how we always assess what we do for you here in the office. So let's go back to headaches a little bit. So we talked about the different types. There's something out there as well that when you look in Eastern medicine, they think that gallbladder has a lot to do with headaches. One way you can tell if it's gallbladder 2 is you'll feel a little pain a lot of times in this part of the abdomen, and or more in the center, either way, off to the right a little or up in the center, and that'll usually go along with it. You can also get a little nausea along with your headache. Now, as a caveat, that's something that also shows up in migraines. And so the best course to do is always have someone that knows about headaches come in and they can look at all the variables and help you get a better diagnosis and handle of what's going on, which we do. So let's look here at we're going to look at the medical solutions. Let's talk about tension headaches to start with, okay? So when we look at tension headaches, the solutions here in medicine are going to usually be a spasmodic of some kind, antispasmodic, anti-inflammatory, all right, something to knock the inflammation down. Sometimes if it's severe enough, they'll even go into immune suppressive type drugs or steroids. They kind of play along the same playing field of what they're trying to go after. And then, of course, the pain medication. And the last but not least is then they'll refer you to physical therapy, and which is a good thing. Physical therapy is a good thing, and these other things, if you're not sleeping, they can have their role short term. We're not saying that you can't do these things, but they are short term solutions, and I just want you to be aware of that. The PT, the problem we have with PT is that we do a lot of PT here actually as well, but it's in the order that it's usually done in. So when we fix a wound, we always follow a 3-step process. That's first, you have to get proper motion into the joint. And the best thing to do that by far, and the most cost effective, has been shown, and the most time effective has been the adjustment. And that's something a chiropractor does. After that, you begin to go after the exercise, this combination of the stretches or strengthening exercises. And it's even more effective if your practitioner has good knowledge in postural, how to restore proper posture. And that's because, and especially in the case of the tension headache, proper posture, if you want to hand me that real quick, removes a lot of the workload. In other words, if you have somebody like this and their posture's out here, the weight of this head is magnified and also by this, and it pulls more into the soft tissue structures where you get more of your chronic repetition, your injury, your tendinopathies. And that occurs from that bounce of that weight out there. You're taking away the advantage of being weighted on the bone where it can stabilize you a little better and where it floats. But it's also just getting that head weight away from your body, just like if you're going to hold a bowling ball close to you or if you're going to hold it way out. it's a lot harder to hold it out here, and it's the same way for your neck. And that stress will cause tension into the scalp that pulls over the head because they all anchor into there, and that's where you get your tension headaches. That's a contributor to it. So having good knowledge of posture and how to restore that is important. And so when we come in here, we kind of go at it from a couple of points. We can do from speaking of tension, we have nutritional stuff that'll decrease your body's desire to spasm or react as hard. That's the short-term solution that's sustainable. Then the next thing we like to do is we remove pressure on the nerve. We do that physically. We can do that with the adjustment primarily and or traction. And then we go after improving the posture or improving the circumstance of that joint. Sometimes it is things that we have to do nutritionally because the body's sick. You maybe have a nutritional deficiency. But overall, we're going to go after the improving your posture, and that'll decrease the workload on that area and give you the longest term solution. So I hope that helped today a little bit, kind of how you approach these things. If you have things like migraines or hormone or cluster headaches, any of these others, we look into the structural side as well, but we also start looking pretty heavy at the nutritional side. And that's where some of those treatments that we do for gallbladder or vascular health, those things can come into play. And we have ways to balance your hormones out a little bit too without offsetting them too much. And without getting into that too heavily, a lot of times when we supplement synthetically, if you have a hormone balance and you're getting them supplemented synthetically, your body will react to that and eventually override it, and to where you have to have more and more, and then it just creates an environment where it's not as sustainable as some other options that you can do. And we can talk about that in future videos. But until then, if you do have a headache that's bothering you quite a bit, we invite you to come in and get that assessed, and we'll look at all these options for you and give you some good feedback that way, and hopefully some good solutions if it's something that we treat. And until then, this is Dr. Jon Gray, and I'll see you next time.